I am Niccolo Mencacci, and I'm a movement disorder neurologist and neurogeneticist at Northwestern Medicine. Parkinson's disease 30 years ago was thought to be a non-genetic disorder. We have now learned that genetic plays a critical role in basically every patient with Parkinson's disease. Yet there's a lot more that we need to understand of how this genetic basis plays a role in every patient. We have recognized that there are about 90 genomic loci that are associated with an increased risk of Parkinson's disease in patients with sporadic Parkinson's disease. The monogenic causes of Parkinson's disease, rare mutations that cause familial Parkinson's disease or early onset Parkinson's disease, were discovered initially thanks to studies of large families with these conditions. Thanks to the advent of next generation sequencing, we have been able to study much larger number of cases with young onset Parkinson's disease or familial Parkinson's disease, and more genes have been linked. There's another type of analysis that's become very popular over the last 5 to 10 years, which is genome-wide association studies. And thanks to these studies, we are now linking common variants, meaning that these are genetic variants that are very frequent in the general population, and they confer an additional risk of developing Parkinson's disease. We're now understanding how variants in genes that seem to participate to shared molecular pathway are driving this increased risk of Parkinson's disease in several individuals. And this is critical for understanding the disease and paving the way for future drug discovery. Now, another great example of how genetic is enabling us to grow our understanding of the disease is the recognition of mutations in 2 other genes linked to Parkinson's disease. One is called LRRK2 and the other one is GBA. About 5 to 10% of all patients with Parkinson's disease will carry mutations in these 2 genes. These 2 genes have been recognized to be the most common causes of familial and early onset Parkinson's disease. And because both genes are targets of potential compounds that may modify their effect, there are now several clinical trials that are ongoing trying to modulate the activity of the products of these genes as a potential new way of slowing down Parkinson's disease progression. The discovery that GBA mutations, which were previously known to be linked to a very rare disease of childhood called Gaucher disease or Gaucher disease. Now we know that mutations in the same gene are also the most important risk factor for Parkinson's disease. And this gene is linked to lysosomal function. This discovery has opened a completely brand new avenue of research in understanding the role of lysosomal dysfunction in Parkinson's disease. Genetic studies in patients with Parkinson's and other movement disorders represent the first step for precision medicine. Because by recognizing the genetic basis of each patient with movement disorders that we treat, we can identify whether there are specific molecular targets that are driving the disease of the patients we treat.